As part of your program, your virtual health and wellness coach Nigel will ask you to take blood pressure readings. He will typically ask you to take a single reading from your left arm and report back. In this short video, we will show you the correct way to take a blood pressure reading and how you should reply back with it. Here are the steps for correctly taking your blood pressure reading and reporting it back. Same time every day. Nigel will ask you to take your blood pressure at the same time each day. Try your very best to take it as soon as you receive the notification or within 2 hours of receiving this message. Go to the toilet first. Many things make your blood pressure rise for a short time. Make sure that you do not have to use the toilet and that you have not just eaten a big meal. Also, do not measure your blood pressure within 30 minutes of drinking caffeine or smoking. Wear loose clothing. Wear loose-fitting clothes like a short-sleeve t-shirt so you can push your sleeve up comfortably. Relax. Make sure you are relaxed and comfortable. If you are anxious or uncomfortable, this will make your blood pressure rise temporarily. If you feel anxious, try closing your eyes and taking 60 slow, steady breaths. Left arm always. If Nigel does not ask you to specifically take blood pressure from both arms or from your right arm, then always take your reading from your left arm. Keep in mind that each arm will always give you slightly different readings, so it's very important to always use your left arm for consistent readings. Sit for 2 minutes before taking a reading. Before you take your reading, rest for 2 minutes. You should be sitting down at a quiet place, preferably at a desk or table, with your arm resting on a firm surface and your feet flat on the floor, uncrossed. Support your arm. Make sure your arm is supported and that the cuff around your arm is at the same level as your heart. You may need to support your arm with a cushion to be sure it is at the correct height. Your arm should be relaxed, not tensed. Cuff not too close to your arm crease. The monitor's cuff should be about 2 finger widths from the crease in your elbow, and you should be able to fit 1 finger between your cuff and your arm when it's fastened. Also, make sure your arterial mark on the cuff is among the center of the inside of your arm. Sit back. Be sat in a chair with a high back and at a table. Sit with your back against the backrest so you are sat up straight. Take your reading and report back. When you are ready, take your reading. Make sure that you do not talk or move when the reading is being taken. Remain relaxed. When the reading is complete, note down the numbers displayed on the screen. Your BP meter should give you 3 things: your blood pressure numbers in the format of systolic over diastolic, in the example here 120 over 82, and your heart rate, in this example 71. Click on the link in the message Nigel sent you, and this will open up a keypad to enter your numbers. Enter your reading in the format systolic, diastolic, heart rate. As per example, enter 120, 82, 71 and click on Save. Wait for a response that it was a success. Take multiple readings if needed. If Nigel detects a very unusual pattern in your last reading, he will ask you to take multiple readings until he can confirm or dismiss the irregular pattern. At most, Nigel will ask you to take 2 extra readings, so please comply as it's very important. Each reading should be taken 2 minutes apart. Remember, your readings are always available to view in CareView. Please note the following. Whenever you receive a message from Nigel asking you to take a blood pressure reading, please try your best to take a few minutes to break away from your busy routine and comply, as the request for the data is usually tied to a specific time of day. If you are not in a position to respond right away, that is perfectly fine, but please take the reading within a few hours of receiving the message. Good luck, and we wish you the best on your program.